Hello friends, my name is Dr. Prashant. We are going to talk about frozen shoulder today. This is one of the most common problems which affects a lot of patients in shoulder. We are going to talk about what are the reasons of frozen shoulder. We are also going to talk about the different ways in which we can treat them. So, first is what exactly is frozen shoulder? It is the painful restriction of range of motion of the shoulder, which means that in patients in this particular problem are not able to reach the back of their head, reach out to pick up any objects from the desk or from the table or from the cupboards. They are also not able to reach their back and clean themselves in the toilet. They are also not able to lift heavy weights, and it's very painful. Especially in the night, it becomes more painful. Shoulder is one of the most mobile joint in the body. It has maximum range of motion as compared to any other joint. Now, what helps the shoulder to have this kind of movement is it is a ball and socket kind of joint which is surrounded by a capsule or a covering, and it is surrounded by a lot of muscles which give it support. What happens in frozen shoulder is that the capsule or the covering which is around the ball and this socket becomes thick and swollen. This leads to the pain, and because of thickening and contraction of the capsule, the range of motion becomes less, which means that the ball rolls less along the socket as compared to normal people, and this is what leads to pain and also leads to reduced range of motion. So there are three stages of frozen shoulder. First is the freezing stage. In freezing stage, there is slow increase in the pain in the shoulder. As the pain increases, the range of motion or the movements of the shoulder joint reduces. The second stage is called as frozen stage. So as the name suggests, frozen, which literally means that the range of motion is limited very less and the pain component is really high. Now this probably lasts for about 6 months, the second frozen stage, and this is the stage which is most difficult for most of the patients to deal with. The third stage is thawing stage, in which the pain reduces and the range of motion or the movements of the shoulder joint increases drastically. So all the stages span over a period of 1.5 or 2 years. There are ways in which we can reduce this duration. You don't have to suffer for 2 years if you know the few things which we can do to overcome pain and also restriction of movements in frozen shoulder. So what are the reasons why frozen shoulder occurs? Firstly, it can occur because of any injury or any fall. So that leads to any injury inside one of the tissues in the shoulder. The second reason is, of course, immobilization. If someone who had an injury or who had a surgery and who has kept their arm immobilized or in a sling for a very long time and now has not moved it, then the capsule contracts because of lack of movements, and this can lead to frozen shoulder. It is also more common in patients with diabetes and thyroid. So there's several things which you can do at home to prevent and treat frozen shoulder. First is taking pain medication when there is pain in the shoulder. Second is to put ice at least 2 to 3 times in a day. This has to be done for a period of 10 minutes by wrapping up an ice pack around with a towel. Third one is home-based stretching program. My whole video on how to do the stretching step by step is mentioned in another video, the link for which is mentioned in the description below. Then when these home-based program is not helping out with the pain and restriction range of motion, you're not able to sleep, you're not able to see any improvement in your condition, then you can definitely see a shoulder specialist for this problem. What a shoulder specialist does is they usually get the help of investigations like X-ray and MRI after a routine checkup of your shoulder, and the X-ray and the MRIs actually help us to decide whether this condition, what exactly is the cause of frozen shoulder. Is there some underlying injury which needs to be dealt with so that you can overcome the frozen shoulder? The treatment line usually preferred by doctors are, first is physiotherapy, which really helps us with different modalities like ultrasound, electrical stimulation, cryotherapy and manual therapy for us to stretch the capsule and get the range of motion back and reduce the pain. Another thing which is really popular amongst the doctors is the use of steroid injection, which has to be given inside the joint to reduce the inflammation around the capsule, which helps for reduction of the pain, and this helps you to perform your physiotherapy or stretching exercises in a better way. Then if all of these modalities do not succeed, we have to suggest or advise some surgery which is done arthroscopically or with a keyhole surgery. We call it capsular release. What we do in this is we selectively release the tight capsule which is not responding to any of other modalities in order to get over the pain and improve the range of motion. As soon as you're done with this surgery, doctors usually prescribe an extensive physiotherapy program to get the most of the range of motion or the movement of the shoulder back. So friends, I hope this video was helpful to you in order to understand what frozen shoulder is and how do we deal with it. And I hope you continue to follow us and subscribe us for more information about the videos. If you are in Hyderabad and you're suffering from any of the shoulder problems, you can definitely come and consult me at Apollo Hospital. Thank you so much and see you soon.